Good afternoon and welcome to the 197th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at Drexel University in Philadelphia. Today we have a discussion of COVID-19 vaccines and vaccination with Dr. Peter Hotez. Just a reminder, you can catch COVID Calls live every weekday at 5 p.m. Eastern Time on YouTube. Just go to the COVID Calls YouTube channel to watch. You can also watch COVID Calls on Facebook Live and on Periscope. You can hear COVID Calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle @US of Disaster or @COVID Calls. Please help spread the word and send suggestions for future guests and future topics, and please feel free to suggest yourself as a future guest. As of today, January 7th, 2021, there are 1,889,952 deaths globally from COVID-19, according to the Johns Hopkins University Coronavirus Resource Center. There are 21,354,027 cases in the United States and 362,037 deaths in the United States. Yesterday, a single day record of deaths was reached, according to the New York Times. 3,964 people in the United States died yesterday from COVID-19. We're going to turn to our discussion, just jump right in today, and I'm very excited to have Dr. Peter Hotez on today to visit. Let me just bring him on and introduce him. He probably needs no introduction, considering all of the really crucial public science communication work he's been doing. But let me introduce him. Dr. Peter Hotez is professor of pediatrics and molecular virology at Baylor College of Medicine, where he's also co-director of the Texas Children's Center for Vaccine Development and endowed chair in tropical pediatrics. He's a vaccine scientist who led the development of vaccines to prevent and treat neglected tropical diseases and coronavirus infections. A new Texas children's COVID-19 vaccine is being accelerated in India now, undergoing clinical testing. Professor Hotez obtained his undergraduate degree from Yale and his MD and PhD from Weill Cornell Medical College and Rockefeller University. He's the author of more than 550 scientific articles indexed on PubMed and 4 single-author books. He is also an elected member of the National Academy of Medicine and American Academy of Arts and Sciences, and has been honored by a PAHO, WHO, Research America, B'nai B'rith, American Society of Tropical Medicine and Hygiene, and other organizations. You see him frequently on major news outlets. I feel like I see him almost every day. I don't know how he has time to keep up with everything he's doing. Dr. Hotez, thanks so much for joining me on COVID Calls today.
Thanks so much for having me today.
So I'd like to start the way I usually do, which is just to find out where you're calling from and what the pandemic is looking like there.
Well, I'm calling from Houston, Texas, and Texas has been hit pretty hard this year. It's been one of the worst affected states. It's been about almost 2 million cases, which of course we know is an underestimate by about a factor of 4 or 5. So we've had maybe a quarter of the state affected so far by COVID-19, and getting up to 30,000 deaths. So one of the worst in the country in terms of deaths. So it's been a pretty tragic situation here.
Is there a lot of variability in Texas between urban and rural areas?
Well, it certainly started out as an urban epidemic, and then it moved in, like many other parts of the country, moved into the rural area. Over the fall, it's been really hitting West Texas very hard and up in the Panhandle, but now it's pretty much moving across the state. It's in the Dallas-Fort Worth area in a big way, and South Texas now really bad along the Mexico border. So if you remember over the summer, there was just a humanitarian catastrophe that went on there, very much like, Central America or Mexico, and then and eased up a bit, and now it's back there as well. Houston is a little different because all of the numbers are going up. We have that massive Texas Medical Center, so it can handle the surges a little better. But up in West Texas, the Panhandle, South Texas, like almost like Los Angeles, ER is getting overwhelmed and that sort of thing.
I keep a close eye on Texas, being from there myself, and most of my family still living there. And one of my sisters, actually, who's a public school teacher, just got her first vaccination a couple of days ago. There's been so much uncertainty as to whether or not vaccines were going to be made available. I know you're tracking that very closely as well. And in fact, I saw a news piece. I saw you getting vaccinated in a photograph there. Can you give us a little bit of a sense of some of the struggles within Texas about vaccine delivery, and also any hesitancy out there in Texas in terms of receiving these vaccines?
Yeah, it's been a pretty it's the same catastrophic situation here in Texas as it is everywhere else. We're just not geared up to vaccinate the population. I mean, when you look at our numbers, the population of Texas is 30 million, and we have to vaccinate two-thirds, three-quarters of the country and interrupt transmission. So we have to stop transmission by vaccinating about 24 million Texans over the next 8 months. So it's 1.5 million Texans every month. I have to check that math first. No, I'm sorry, 3 million Texans every month. And so that's divided by 30 is about, it's 10,000, 100,000 Texans every day. And some of the vaccines are 2 doses. So we're talking 150,000 Texans a day. And, we're just not going to have the bandwidth for that.
So
in other words, we're going to have to put some new structure in place.
This is a live broadcast, but it's also a historical project in putting an archive in place. And I would be remiss if I didn't ask you about your day yesterday. At one point yesterday, like I'm sure millions of Americans, got my family together and said, turn on the TV because history is happening. What was your day like?
Well, like every day, trying to keep up with the vaccinations, and in our vaccine program, we're trying to accelerate a low-cost vaccine for the world. We're scaling up to make 1 billion doses. This is being led by Biological E in Hyderabad, India, and testing across India. So on constant Zoom calls regarding how we move that forward and the science of that to try to get this into phase 3 clinical trials, and then discussing with Indonesia and Israel and all over the world. And so that's the day job. And then talking to the nation about COVID-19 and on the various cable networks and on, CNN and MSNBC and BBC, and then more chaos on top of that. So every day is, everybody's working hard. I think that's not new. It's the level of intensity that's always been so elevated, because everything has such high consequences in terms of whether you're saying the wrong thing to the nation or making a mistake in the vaccine. So that there's that level of pressure and intensity. And then top of that, you have a coup in Washington. It's like, what next? It's like a badly made movie about the future, but it's really happening.
But it's very hard to disentangle. I've stopped trying really to disentangle the disaster of the pandemic from the economic impact, the racial injustice that we've seen. I mean, it's all sort of one big disaster. But I wonder if I could draw you out a little bit just about yesterday and the administration, because I don't know, yesterday people were not protesting against mask wearing, but the level of anger in the country somehow, to me, must be connected with this pandemic. I mean, you have a long history of paying attention to pandemic and epidemic. Have you ever seen this level of anger? And what do you think about the connection between the politics of it and what we saw yesterday and what people have been asked to do this year to fight this pandemic?
Yeah, I mean, one of the themes of 2020 and now moving into 2021 has been this rise of anti-science. And it has it's not unique to the US, but it has a unique flavor to the US, and it has historical roots. And I know about this more than anyone because I'm the number one target of the anti-science, anti-vaccine movements. Robert F. Kennedy Jr. refers to me in his public messages as the OG villain, which I had to look up, the original
The
gangster
original.
villain. So
Yeah.
you're talking to the original gang, because I wrote a book called Vaccines Did Not Cause Rachel's Autism, to debunk all the fake links. So this really accelerated. This really accelerated in 2015. So the anti-vaccine movement's been around for a couple of decades after the fake paper alleging links between MMR vaccine and autism. It was in the Lancet in 1998. But then it took this very odd twist in 2015, linked to the far political right. It coincided with President Trump's election run in 2015. Whether that's cause and effect, we could be debated by historians, but it took on this new flavor under the guise of medical freedom, health freedom, kind of a libertarian movement. It actually probably started in Orange County around the time of the measles epidemic there, and the state wanted to close vaccine exemptions, but it quickly shifted over to Texas and Oklahoma, where well-funded political action committees PACs formed. And then you started to see large numbers of kids not being vaccinated because parents said this interferes with our freedom and our health freedom, as the term was. And also folded in were conspiracy theories and faux links to autism. And it got to the point where we, started seeing 72,000 kids be denied access to their vaccinations in the state of Texas. And that had nothing to do with the homeschooled kids. So we have 350,000 homeschooled kids, and who knows how many of those were not being vaccinated. So this was building up. And that's when I got more involved, because as a vaccine scientist working in Texas and running a big group in a lab and developing vaccines, and also the dean of our school of tropical medicine. But, and I said, if I don't stand up for this, who will? Because I have this daughter with autism, and I have 4 adult kids, and wrote this book, Vaccines Did Not Cause Rachel's Autism, and to debunk all the autism links and explain what autism is. So it put me right smack in front of this thing and this anti-vaccine train. And then it morphed again in 2020. A couple of things happened. One, then Robert F. Kennedy got involved at the national level and started forming Children's Health Defense. And if you remember, right before President Trump was inaugurated, he came out and said he'd been tasked with heading a vaccine commission, which, who knows what that would have looked like. And then in 2020, what was an anti-vaccine movement glommed on protests against social distancing and masks and contact tracing. So you had now a conflation of anti-mask, anti-vaccine, and political extremism on the far right. And all of those things kind of merged together. And then you saw it export to Western Europe last summer. There were these big combined anti-mask, anti-vaccine protests in Berlin and Paris and London, and New York Times and BBC reported it was linked to QAnon and far right-wing extremist groups. So what you're seeing now is this kind of confederacy of political extremism on the far right, anti-vaccine, anti-science groups. And then to make it all the more fun, you have the Russians piling on with bots and trolls. And so I've been writing, because, I'm so well positioned to address this. I've been writing and speaking about it in part to try to understand it all, because there's no roadmap really to go by. And you have to also be very careful how you message it too, because, you start going on about far right-wing extremist groups and QAnon and the Russians and you start sounding like someone who throws things at the TV at night. So trying to find a way to say this and sound credible is in itself a challenge.
Well, there's so many streams there that you were just, articulating really well for us. I mean, one is, parents who have concerns about the autism diagnosis and vaccine in one group. But then the
politicization of it, that was for me, that was the game changer in 2015. And that's when you saw people tying dislike or distrust of science with being part of the far right wing of the Republican Party. That to me was the really strange piece, because historically there's been nothing anti-science about the Republican Party. I mean, NASA was
Sure.
started in the Eisenhower administration, and George W. Bush, created PEPFAR, the President's Emergency Plan for AIDS Relief, and our neglected tropical disease program was started under Bush. So
Under
it
Bush.
was odd, I still don't understand how and why that all happened, because it's so self-defeating and so self-destructive.
And we've seen waves of anti-expert politics in American history and anti-science politics in American history. I want to ask you, I mean, how much do you see this as a battle that can be, maybe one is the maybe battle is the wrong metaphor, but I mean, if it's a contest over values in the public square, what's it going to take to move trust, to erode some of that building anti-science politics that you've identified here?
Well, I think a few things have to happen. I mean, the level of communication has been poor, especially around COVID-19
Right.
vaccines. Operation Warp Speed was a good program in terms of scientific integrity and rigor, but there was never communications attached to it. It was left to the pharma CEOs, who did a generally poor job as communicators. So that was one problem. And so all of 2020, I'm on Zoom calls about how we fix the message, get the message out about, COVID-19 vaccines are safe, they're not rushed. And I can go through that with you, but, then I say it's, fine to have the message out, but then I deflate everybody by saying, well, but that message is a message in a bottle in the Atlantic Ocean, because the anti-vaccine and anti-science groups, now this combined juggernaut, just dominates the internet with
Mhm.
480 fake anti-vaccine websites, all revved up on social media. If you go to Amazon.com and you put books up at the top, click like everybody has done, and you get the scroll down menu at the left. You go to health, fitness, and dieting, click on that again, and go to vaccinations. It's all fake anti-vaccine books, all fake COVID conspiracy books. So they dominate the internet. And I say, the message will, it's good to get the message out and fine tune the message. And then I say it'll get you 30 to 40% of the way there, until we do something to start dismembering or dismantling the anti-vaccine, anti-science presence on the internet and all their rallies and everything else. It's just not going to have an impact. And that's
Mhm.
where people start walking away from me, which is kind of interesting. That's on that piece, I've really been an outlier, because nobody wants to touch that. Nobody, it's just, that's not something academics, they say that's not what we do, and that's not what the federal government does. We're not going to go up against the anti-vaccine groups like you do, Peter. That's too scary and dark a place for us. And so, and that's where it gets very lonely for me, is because of, oftentimes don't feel supported on it, but I think it's absolutely necessary.
Well, you have been outspoken about the failures of the federal response to COVID-19, and just a few days ago in the Hartford Courant, you had an amazing quote about Operation Warp Speed. But he said Operation Warp Speed dropped off 20 million IKEA boxes with a big sticker that says "Assembly Required," and the states
Yeah.
are scratching their heads trying to figure this out. And you say it's not going to work. So we've got problems with the communication, we've got problems with the logistics. What are you looking for in a Biden administration to begin to, you know, push back on the science miscommunication, the disinformation, or to begin to solve these logistics problems? Because we've seen some states may be able to take this on. Even the states that have done well have struggled. But Idaho, Louisiana, even Texas, Florida, they're struggling.
Yeah, I mean, I think what I've been really pushing hard on is take a step back and look at the framework. Because people sort of lose the forest through the trees pretty quickly in this COVID-19 epidemics. It goes something like this, that's right. All through the summer, I was heavily criticizing the White House Coronavirus Task Force, and basically they refused to launch a national response. It was all about putting the states in the lead, and the result of that was we missed the entry of the virus from Europe into New York. We failed to ever really fix diagnostic testing in the United States. We failed to halt the southern surge over the summer. We failed to halt this current surge. We're not doing any genomic virus sequencing to speak of, so we're missing UK and South African variants and homegrown variants. Every time we've called on our government public health response, they've come up small or have been invisible. And the consequence of that, and then you had the Scott Atlas and the whole White House disinformation campaign, claiming COVID was a hoax or downplaying the severity of the epidemic, or saying that COVID deaths are due to other causes, or discrediting masks, or spectacularizing hydroxychloroquine. The consequence of all of that means that we have nothing. We have nothing except vaccines. Our own, basically we've now been backed into between the failure to launch a national response, the disinformation campaign has put us in this place where we have no other choice but to vaccinate our way out of it. That's all we have left. So Scott, here's the plan. The problem, we now have to vaccinate 240 million Americans against COVID-19 between now and later in the summer. So you do that math, that's 1 million to 2 million Americans every day from now until August. And the question is, can we do it? Well, first of all, we have to. We have no other choice. We can no longer take the easy route. We can no longer. This is finally a time where we really have to step up. And one of the things we've learned is the infrastructure is not there, right? Because, dropping off the IKEA boxes, what that really means is there was no national infrastructure put in place. It's basically relying on a very depleted health system. And the depleted health system is comprised of Amazon Pharmacy, Walmart, Sam's Club, CVS, Rite Aid, Duane Reade, and the hospital chains, and a few scattered community health clinics in some of the low-income neighborhoods where there's pharmacy deserts. That won't do it. We're not going to get to 1 to 2 million Americans vaccinated a day. So the first thing to do is we've got to create some infrastructure to make that happen. We've got to figure out a way how to do this in a very high throughput way that's not currently in place, because we haven't really given adult vaccinations on anything like that scale. I mean, if you think where you get your adult vaccinations, where I do, I get it at our, we have a big grocery chain down here called HEB. That's where I get my Shingrix and Tdap. And that's where a lot of Americans, that won't be adequate. So, how do we, create, you're based in Philadelphia.
Right.
So, the University of Pennsylvania football stadium, or the Eagles football stadium, where the Phillies play, how do you open that up to get high throughput vaccination and have the support staff needed to make that happen, and to handle the parking and everything else? There's going to need funds for that. And
is that what you're envisioning as we go into is that the kind of thing you're envisioning? And
that's the only way I see getting to that kind of level of high throughput that you're going to need. It's, there's just so big you can make CVS, right? So so we're going to have that, something like that. That's number one. And then it's not so straightforward, because you still have the supply chain issue around vaccines.
Right.
That mRNA vaccine technology is not nearly as robust as we like in terms of scale, right? I mean, the plan behind Operation Warp Speed was never to rely on the mRNA vaccines. Those are the first ones out because you can make a piece of mRNA pretty quickly.
Right.
But it never had the technology is too immature to rely exclusively on that. And that was always the case. So we now have to get the 2 adenovirus-based vaccines up, the particle vaccine, maybe our recombinant protein vaccine. And then you could really start doing all of those things. So all that has to happen now. I mean, you can't, we don't have, because every day we wait, I keep changing the number. First, it was 2,000 Americans dying a day, 3,000 Americans dying a day. Now it's up to 4,000 Americans dying a day. This is what we have to do.
Well, I want to ask you about that, because that's on all of our minds, and we've blown past every measure and every norm. and there's a lot of concern that people have just become inured to this and said, well, it is what it is, and it'll just end when it ends. That's obviously an unacceptable answer, and yet I'm hearing that. I mean, this is the kind of discussions early on when you heard Scott Atlas you mentioned talk about, well, let's just go with herd immunity, and if older people died, and that's
Yeah,
the
it
way
all,
it is.
I mean, and talk about history. We've stopped being a nation that is willing to do hard things.
Hmm.
Nobody wants to do hard, nobody wants to send a man to the moon or achieve victory in World War II or conquer AIDS. Nobody seems to want to do hard things anymore. They look for, and this whole business, of going from 2 doses to 1 dose of the mRNA vaccines or cutting the dose in half. It's sloth. It's lack of ambition to do what really needs to be done. And so by doing that, you're just taking a crappy infrastructure for making vaccines, for administering vaccines, and turning relatively good vaccines into crappy vaccines on top of the crappy infrastructure. That's not the answer. The answer is to fix the infrastructure and get more vaccines out there. And it's people are scared to do hard. I mean, I'm old enough to remember when we did hard things, and we kind of have to get back to that.
But do you have a sense that this year, I mean, we've seen youth movements. I mean, my college classroom, I'm hearing students talking in ways I've never heard them talk before about wanting to take on these hard things. I mean, it's not impossible that these
Yeah,
infrastructures can be built.
The commitment of young people to want to do good in the world and for public service. This is an all-time high. I mean, everyone makes jokes of that younger generation. The younger generation's all in. They're ready to roll up their sleeves and do stuff. It's my generation that's half asleep all the time, and it doesn't want to seem to take this on. And so we've got to capture that youthful energy. All of this is doable, but it takes leadership, and it takes commitment. And so what I've been telling journalists is that, look, the first question you need to ask every elected official you talk to or interview is, what are you doing to vaccinate the American people?
Mm.
It's got to be like, what did you do during the war, Daddy? Now it's, what are you doing, Daddy and Mommy, to vaccinate the American people? And every elected leader needs now to be able to articulate right out of the starting gate what that individual has done to get people vaccinated.
So, thinking as we go into 2021, can you say a little bit more about what, we have the national vaccine strategy. Obviously, that needs revamping. There's so many things this administration is going to have to pick up, and you were touching on this a little bit earlier. But who are going to be the key players to watch here? We're going to have a new Secretary of HHS. We're going to have a new leadership in FEMA across the board. I know the government doesn't get a chance to redo with something like this. But what are some of the very specific things you'd like to see the administration do right out of the gate?
Well, articulate a roadmap and plan to vaccinate the country, obviously, and then assign who's going to do it. I think one of the big unknowns for 2020 is why did the Centers for Disease Control collapse in 2020, which is basically what happened. I mean, as I say, they came up small every time. They ranged from either being invisible to incompetent, and everywhere in between. Again, failing to detect the virus coming in from Europe, never launching a national plan. I mean, this is why we pay $11 billion in taxes to the CDC. They're supposed to be the envy of the world. Why aren't they leading a plan? Why is it that they took on the virus genomic sequencing project of only sequenced 50,000 virus genomes, which, the University of Pennsylvania Genome Center used to be run by my friend and colleague David Roos. I don't know if he's still running it now, but should be able to do that in a period of months, right? I mean, Penn alone. I mean, why come up so small on that? Also, the guidelines from ACIP, which are very fussy and not even you can't even operationalize it. So, what most people will say, well, it's been the White House incursions and it's been the Trump White House. And I'm sure that's true. but I did sense there's a big infrastructure problem there, and that has to be addressed. Also, we have to have the CDC in charge running this, and they have to be good again. And how do we do that? That's going to be another thing that I'll be looking for, and no more failures. I want to
Mm.
see stuff get done, and I want to see the American people get vaccinated, and we have to do this.
And you think it gets harder for governors in states that have not been willing to follow mask mandates or that might have been moving slowly on the vaccine? This relationship where no longer they can look to the White House for cover. You're going to have a president, presumably, who's going to really take on the science communication piece of this. What do you expect governors to do in states that have been intransigent on this? Do you think they'll fall in line with the White House, or is this just going to be the continuation of this Trump era?
That's right. Is it going to be this kind of political posturing? And again, tying showing your allegiance to the far right wing of the Republican Party by being anti-science. We've got to somehow break that, because it has it has no basis in the history of the Republican Party. It's quite the opposite. I mean, the National Academy of Sciences was founded under Abraham Lincoln, a Republican
Right.
president. And as I said about NASA and everything else, we have to kind of figure out a way to fix that again, and get people to understand the history of this. I mean, why do people admire the United States? Yes, the military is a component, but the other piece is the our research universities and institutions. When I served as U.S. science envoy for the State Department in 2015, 2016, the Obama administration, I got to meet government leaders all over the Middle East, North Africa,
Hmm.
and they all trained at U.S.
Sure.
universities, right? And did even their doctoral degree or master's, and not even just the Harvard, MITs, and Penns, and Stanfords, and Berkeley's, right? They were at University of Iowa or Iowa State or University of Illinois Urbana-Champaign. I mean, these are our national treasures, and these are our greatest ambassadors. We've got to find a way to get people to get on board with that again.
So I'd like to go back a little bit. I don't know, maybe you had anticipated in your career that you'd be working on this compressed time frame at some point in your life on a coronavirus, but you've been working on vaccines now your whole career. Can you tell us a little bit about how you first got into that work and why it has remained intellectually satisfying to you?
Well, ever since I was a undergraduate, I wanted to make vaccines for tropical diseases. That was sort of probably the most goal-directed person you'll have on the show. I'm doing now at 62 what I wanted to do at 22, even earlier,
Mm.
and this lifelong dream to make vaccines that no one else will make because they're for diseases of the poor. And we've have vaccines for diseases like hookworm and schistosomiasis and Chagas disease in clinical trials. And then we adopted a coronavirus vaccine about a decade ago, working with a group out of the New York Blood Center, that kind of began working with us because those vaccines were orphaned as well back then. Nobody really cared about coronavirus vaccines. And so it's being basically a physician scientist. And that I always wanted to do. I wanted to do that. I think the newer piece is the public engagement and
Mm.
science communication. That's a more late onset adult affectation that really started when before this job, I was chair of microbiology at GW, and being in Washington, just got caught up with that and found I liked it, and found
Mm.
I had a voice communicating about pandemic threats and neglected diseases and neglected tropical diseases. And so ever since, I've been trying to balance those two worlds of being a scientist and yet, keeping a foot in that public engagement. And then, having that decade of experience with coronaviruses and coronavirus vaccines positioned me pretty well when COVID-19 emerged. And I find it very meaningful to be able to talk to the American people, but it's also a lot of pressure too. If you get it wrong, you hear
Sure.
about it pretty quickly. I think for one of the things that I've realized about science communication is, I try to thread the needle between the two major mistakes that people make. And one of the common ones is the lapsing into jargon and being unable to explain the science without using overly technical words. But that's actually not the most common mistake people make. The most common is what we heard from the White House Coronavirus Task Force. Somebody in a school of communications or journalism school 30 years ago told all the scientists that they have to speak to the American people like they're in the 4th grade or 6th grade.
Hmm.
And I think that maybe worked before something called the internet came along and
Right.
and
Yeah.
social media.
Yeah,
And
exactly.
people are a lot more sophisticated. And one of the best compliments I ever got, I became a writer also in the last decade. I've written 4 books, single author books, and my publisher, Johns Hopkins University Press, Robin Coleman, said to me, Peter, what you have the knack for is you're able to communicate complex scientific concepts without the jargon, but without sounding like you're condescending or talking down to people. So, and that's something I work on all the time, and it's very meaningful, and very needed too, because in this absence of communication, it's being filled by the anti-science
Right.
group. So
As you
one of
said.
the things I've been writing and speaking about is we need to train a whole cadre of scientists who are willing to engage the public and speak to the public. And the young scientists are all in. It's, again, we don't have the infrastructure put in place to make that seem like a welcomed activity. Academic health centers don't like their scientists and their docs speaking to the public. They're obsessed about controlling the message, and they don't care if you're talking about social justice or combating anti-science. They're very risk averse. And so to be a scientist or a physician engaging the public, you do it at great peril, because
Sure.
it's not looked upon as a welcomed activity or even an important activity.
Well, and I'm sure it's the same in science as it is in humanities and social sciences. Tenure committees don't look at media appearances as criteria.
That's right. Absolutely.
We have to
I
change
mean,
the
am I,
incentive game.
yeah, on my annual evaluation form, I get evaluated like everybody else, even though I'm a dean and a professor. It's got a place for my grants, and it's got a place for my papers, scientific papers, and it's got a place for my grants, and it's got a place for my scientific papers,
Right.
and it's got a place for my grants, and it got a place for the scientific papers. And the idea that, there's not even
Rachel Maddow doesn't,
in,
there's
in
not a
a,
line for that.
no, I mean, even in an academic health center, they don't even care about your books, right? They don't, that books, what kind of revenue do books bring in?
Exactly.
Especially with academic presses, right? So, or, who cares about op-eds you've written or media appearances, so the message is set in a very, not even subliminal way, pretty explicit way. This is not valued by your institution. So if you're young, especially if you're a young person trying to start out, all of this stuff that you're trying to do the public engagement is seen as either frivolous, unimportant, or even worse than an annoyance, is a threat to the institution. And you throw that to the mix, and it's a showstopper.
We're almost up on time. I just want to circle back something you talked about, your fascination, your career working on vaccines for diseases that strike in poor parts of the world. And one of the things we've learned this year, we shouldn't have had to learn it, but the enormous health inequality in the United States, and communities of color being unequally impacted by the pandemic, and also the economic implications of that, which are all rolled in. So to a certain extent, I wonder if it's been strange for you somehow. So much of your focus has been on these other kinds of diseases, on parasites, for example, and now people are rediscovering poverty in America. It seems like not everyone, not as many people as you think, but it's been front page news again. These health inequalities.
And I've really tried to shine a spotlight on using that global health lens on diseases of the poor in the U.S. So in 2016, I wrote a book called Blue Marble Health that actually points out, when you add up where all the poverty-related neglected diseases are, yes, they're in fragile nation states in Africa and Asia, but overwhelmingly they're in G20 countries. The group of 20, it's the poor living among the wealthy that now account for most of the world's poverty-related neglected diseases. And I have a chapter in the U.S. where I estimate there's 12 million Americans living with a poverty-related disease, but they're often off the beaten track. And so one of my faculty members, Rogelio Mejia, worked with environmental activist Catherine Coleman Flowers. We found hookworm in rural Alabama. So the point is, these diseases are they're not even rare. They're pretty common. It's just that they're occurring among the poor, so they go sight unseen. Right. And so now we've been working with Senator Cory Booker from New Jersey and a Republican Congressman, Chris Smith, and Hank Johnson from Atlanta to file legislation. And the interesting thing about that is, trying to spend decades raising awareness about neglected diseases of poverty in Africa, and it hasn't been that hard. I mean, people sort of got it. There was AIDS, there's malaria, there's TB, now there's neglected tropical disease, that fourth leg. But when you talk about diseases of the poor in the US, the lights just go out quickly. I mean, nobody wants to talk about it. And so I've been really struggling. That's been one of the hard, after hitting a home run, raising a lot of money and getting billions of people treated on neglected tropical diseases. I say, hey, this advocacy stuff's not so hard. And then I started trying to raise awareness about neglected diseases of the poor in the US. It's been a hard slog. And now with COVID-19, that's going by the same playbook. It's disproportionately affecting low-income neighborhoods because the nature of the essential work. And, if you're working in a bakery or a family-owned business or on construction sites, you're not working via Zoom and Skype, right?
Absolutely.
So they're getting hit hard, and they live multi-generational homes, and so they're bringing it home to mom and dad or grandma or grandpa, and they're getting decimated. So especially in the Hispanic communities, they've been hit especially hard. So I testified to the Congressional Hispanic Caucus, and I called it historic decimation of Hispanic communities, and pretty much the same with the African American communities. I mean, we're seeing 30 to 35% of the deaths under the age of 65 in these communities. So that's been really tough to get people to care about. That's one of the hidden aspects of this COVID-19 epidemic, and I'm running into the same struggles around COVID-19 that I did with the other neglected disease of poverty. So the first time was a home run. The second one I struck out, neglected disease of the poor in the US. And the third one, maybe I'm going to get a single out of it, fighting the anti-vaccine movement. So my advocacy and public engagement, I don't try to be everything to everybody. I tend to say, okay, here I'm a subject matter expert. There's a vacuum, there's a gap. I have unique knowledge. I'll fill it with that, and I love it, and with varying degrees of success.
All I can say is thank you for what you do, and keep doing it.
Thanks.
And it's an honor to speak with you today, and thank you for carving out a little time. I know every day is busy. I was really happy to talk with you today, particularly coming after everything we saw yesterday, because I think you've got a unique position to speak as a scientist who's also engaged in the politics of our moment. And I don't see how anybody can disentangle those things anymore. And when they try to, I think they're being dishonest.
Well, that's the fight, right? I mean, because what you're told as a scientist, okay, you're a scientist. Don't try to talk about the politics. Just stick to the science. Stay in your lane. Stick to the science. But when the disinformation campaign started, first of all, I knew about disinformation campaigns going up against the anti-vaxxers all these years. I could smell a disinformation campaign a mile away, and these guys had every aspect of the playbook down. And the only way to disentangle the politics from the anti-science was to call it out, and required you to get your hands dirty talking about politics. And a lot of people don't understand. It's not that I want, I don't like throwing darts at the White House. I mean, that's a scary place to be. And you can imagine emails and and all the other crazy stuff, but there was no other way to do it. And then when people say, well, what you're doing is inappropriate, even my colleagues say you shouldn't be going into that political realm. Well, I didn't go into the political realm. They did. I'm just trying to disentangle it. But it's a tough place to be.
I want to remind everybody that you've been listening to COVID Calls, and you can catch COVID Calls live every weekday at 5 p.m. Eastern Time. We'll continue our discussions tomorrow of vaccines, so please do Join me for that. We'll be talking about law and policy and vaccines and COVID-19. Be talking with Ross Silverman and Dalit Reese and Tara Hayel tomorrow. So please do join me for that. And I want to thank you again, Peter Hotez, for your time and for all you're doing. Thanks
Thank you, and thanks for what you're doing. You're providing an enormously important service doing this, and this is what universities should be doing. So thank you.
All right. We'll see you soon. Stay healthy. We'll see you tomorrow, everybody, 5 o'clock.
Bye-bye.